Mornings with Richard Cross, SuperTalk, Mississippi. Thanks for joining us. Thanks for being part of the conversation. Time to welcome our next guest. Dr. Katherine Pannell joins us right now. She's a DO, medical director at Right Track Medical Group, and is legislative chairwoman for the Mississippi Psychiatric Association. Dr. Pannell, good morning to you.
Good morning.
Always a pleasure to visit. I feel like the topics are always heavy when we talk, though. We're talking about some tough stuff. This week in particular is Overdose Prevention Week. And we know that that is a very, very serious issue that unfortunately is far too common, and it's far too common in a lot of cases with young people.
Yeah, you're right. And I do. Sometimes I come on here with a lot of gloom and doom, but we actually have some good news, even though it is Overdose Prevention and Awareness Week. Mississippi's doing a good job in preventing overdoses. You know, we saw the peak of the overdose deaths in Mississippi in 2021 during and after the pandemic. But since that time, we've seen about a 34% decrease in overdose deaths in Mississippi. So not all bad news today.
Yeah, that certainly is outstanding progress, but a long way to go.
Right. Right. We're still in crisis mode.
Yeah. In terms of overdose deaths, do you have any idea what the numbers are for overdoses that are bad pills versus people who are taking prescription medications and are abusing them?
I don't have the exact numbers, but I will say that back when opioids were first produced, it used to be overdose on prescriptions that were the prevailing cause of the overdose deaths. They were, getting too many pills from the prescriber. They were doctor shopping. But now it is more prevalent to see overdose deaths of those pills that are being made and are synthetic, or that they're pills that are laced with other things that are causing the overdose deaths. So we've got control over the overprescribing of opioids now. It's more the illicit, off the streets opioids, the synthetic opioids.
Are college campuses the biggest place, or is that just a kind of a target-rich environment and it's happening in lots of other places as well?
There are definitely hot spots all over Mississippi, certain counties more than others. But yes, college campuses, especially for our college towns with college campuses, are especially the hot spots for our younger adults.
What about, we've talked with law enforcement officials, from DPS down to local officials, and we have heard about more seizures, more confiscations, more busts that are happening. But we also know that it only takes a very, very small amount of methamphetamine being laced into drugs that people think they're taking. Are the seizures and the busts having an effect yet?
Yeah, of course. Getting the supply off the streets is always a major force in reducing overdose deaths. But I think the major emphasis has to be on reducing the demand. And that's where we come in with, decreasing conversations or the stigma around conversations about opioid use and pill use, teaching our kids early on about coping skills, teaching our kids early on that unless the medication is prescribed to you, it's not safe to take. Because you're right, it doesn't take much of a pill being laced with a tiny substance like fentanyl, and one time can kill you.
One of the things that we've seen a growth in is the availability of life-saving stuff. Narcan at the top of the list in terms of availability. How important is that in this process? Because there's some that are like, it's an altogether different conversation, but there's some that would compare it to condom usage to eliminate teen pregnancy, and going like, there's a better way to eliminate teen pregnancy than just prophylactics. But this is different than that also. So kind of walk me down that road.
Sure, it is. And it's a huge misconception that somehow things like fentanyl testing strips and naloxone enable addiction. Mississippi, especially the Mississippi Health Department, has done an amazing job about getting naloxone in hands. And that's huge. While we do all the other prevention things like education, these are naloxone and this testing strips are what are saving lives. They've given out, I think, over 30,000 naloxone kits in the past few years. This is just buying us time because everybody has a chance at recovery, but you can't recover if you're dead. So this is simply,
Yeah.
it's not enabling somebody to use a pill or to get a pill off the street. It's basically keeping them alive so that we can get them the resources to get them better. Also, with our impulsive, youth whose brains are not fully developed, they may have just a dumb moment where they go take a pill from a friend because they feel like they need an Adderall to study for the night and don't realize their friend got the street and it's laced with fentanyl. So
Yeah.
it gives them another opportunity to live life and become a fruitful adult. That now Lozing just buys us time.
And hopefully get to a place where they're making better decisions moving down the road.
Absolutely.
In terms of where Narcan's available, are law enforcement officers carrying this? Is it readily available to them in the event of responding to a situation where it's needed immediately?
Yes, they are armed with it. They are trained in it. But anybody can get Narcan, and I encourage anybody. You don't have to be the healthcare industry. If you have a family member suffering with substance, either opioid use, you can go to the Mississippi Health Department website. They will send you a free kit, absolutely free. It's confidential. Nobody will have your information. You're not going to get spam called or anything after that. But they'll literally mail it to you, and you can have a kit to keep on hand.
September also is Suicide Prevention Month. I mean, you can question my sanity, but I was watching a board meeting online for the Oxford Board of Aldermen, and they had a resolution declaring Suicide Prevention Month and awareness in Oxford. I know there are other communities that have done that as well. Katherine, I feel like the conversation has changed so dramatically when it comes to suicide, and I know it's something that you continue to beat the drum about, something we've talked about in the past, and that's the stigma at least being lessened, people being willing to talk about issues in a more public way than they have, and maybe let you take it from there in terms of what we're focusing on, particularly in this month of September.
Well, it's September, yes. It's the Overdose Awareness Month where we just want to continue to decrease stigma and support those that are trying to go through the recovery or maintain recovery. It's also a great month for suicide prevention. And this month is really all about having that conversation so that we do continue to reduce stigma. The stigma is falling. It's fallen tremendously since COVID. Our younger generation is talking about it. We need to continue the conversations and normalize the conversation just as we would any other medical illness, and encourage our youth to talk. Just continue to have those conversations and really learn early on about healthy coping skills and how to manage stress. And that there's nothing so grave that you have to end your life for, that to continue to just talk about it, support others.
I know sometimes we interchange psychologists and psychiatrists, and obviously there's a different, but colloquially just called shrinks through the years. And I've noticed that there is an openness and a willingness with people saying, "Oh yeah, I went to see my shrink or went to see my doctor, my person." Have you seen an uptick in willingness for people to go to a therapist, whether it's a psychologist or a psychiatrist, that maybe didn't exist in the past?
Absolutely. And that again is just from having those conversations. I used to have patients that I'd have to sneak in the back door of my office because they were too scared to be seen going to a psychiatrist's office. But the more
Wow.
people that do go to those psychiatric offices and have those conversations and normalize it, the more people are willing to seek treatment. I tell everybody that everybody needs to be in therapy. Therapy is not there. I mean, it is there for when you're in a crisis, but you want to do therapy to learn the skills so that you can handle a crisis when it comes up, an unexpected crisis. So I think therapy is great for everyone. I think more people are willing to do it. And I think it's life changing.
There are lots of people that have never been to a therapist for any reason. Can you take us inside that office and kind of describe what those I mean, obviously not divulging anything, but what those conversations are like, what those meetings are like. And I guess there are, as you just said, two different sides to it, right? There's crisis situation, and then there's like preventative and wellness type conversations as well.
hmm Yeah, therapy is incredibly cathartic. I mean, that is like it's usually an hour long, and that is your time. That is when you go and you can talk about the things that are on your mind, the things that are bothering you. You go, it's without shame, it's without judgment, and it's completely confidential. So you can tell them the things that are bothering you, not have to worry about repercussions or judgment. That is your time. It's self-care. And it prevents crisis. I mean, it is there, like I said, to help you through it, but it's there more to prevent it, so that when something unexpected does come up in your life, you can handle it.
From the therapy professional standpoint, how much of those sessions is listening versus guiding and talking?
I mean, like, I personally love, because of I'm much more of a listener. But as far as people that are there to get help, they are the ones that are there. Like I said, it's cathartic to let it all out, and then the therapist is there to guide them and help them through whatever they're there for.
September is an important month. Overdose Prevention
Yes.
Week, Suicide Prevention Month in September. Dr. Katherine Pannell, always appreciate your time. Thanks for joining us this morning.
Thank you for having me. Yep.
Mornings with Richard Cross, Super Talk, Mississippi. We're going to wrap things up on this busy Thursday morning when we get back with you right after this.